story in my previous speech, when I was 12, I had a terrible case of the flu, and so my mom gave me Pepto-Bismol, which caused me to have an anaphylactic reaction, which caused my throat to close up. Thanks to amazing doctors, nurses, and the use of an EpiPen, I have been saved. I was in the hospital all that night, and it is still one of the scariest experiences of my life. Before I was released, a nurse gave me an EpiPen and explained to me what it was and why I will need it. After having anaphylactic shock, I was prescribed an EpiPen to carry around with me at all times. This is because I reacted so fast. If I was ever to go into anaphylaxis again, it would be really bad. So I always carry around an EpiPen with me wherever I go. EpiPens are necessary for me and many others' safety, but they are not easily accessible. So I would like to argue to change that for the better. Today, I will be talking about the problem with how EpiPens are hard to get, my plan to solve that problem, and what the future would look like if my plan was implemented. Before trying to improve the problem, it's important to understand exactly what it is. The major problem with EpiPens is that they are not easily accessible. Right now, EpiPens, life-saving auto-injectors, used during severe allergic reactions, require a prescription in the US. This means that people at risk for anaphylaxis must visit a doctor to get access to an EpiPen, which can be costly, time-consuming, and impossible in emergencies. Greer Arthur, a British scientist with a background in molecular biology and immunology, agrees that the current system creates unnecessary boundaries to a medication that can literally mean the difference between life and death. She adds additionally, EpiPens expire every 18 months, which means you need to set up a regular appointment with your doctor just to get one. Also, EpiPens themselves cost $650 to $700 without insurance, which is very expensive, especially for how fast they expire. Having to have a prescription for the EpiPen is one of the reasons why they are so expensive. According to the CDC, the nation's leading science-based organization protecting public health, about 1 in 50 Americans experience severe allergic reactions, and up to 200,000 emergency visits occur each year due to severe allergic reactions. The studies show that delay in administering epinephrine significantly increases the chance of death. Yet, the high cost of administering epinephrine and its prescription requirements prevent many from obtaining or carrying an EpiPen. The CDC found that more than half of at-risk individuals did not have their EpiPen on hand when needed. Now that the problem with acquiring an EpiPen has been explained, how can we fix this? Both I and Dr. Skyer, an MD professor of pediatrics at the Jaff Food Allergy Institute, agree making EpiPens over-the-counter medications would fix these problems. Over-the-counter, or OTC as I will be referring to it, means that a medication can be obtained without a prescription or license. This solution satisfies the problem by removing the prescription barrier and allowing anyone to purchase them directly at pharmacies or online. This ensures faster access, increases preparedness, and reduces preventable deaths. Dr. Mimi Tang, an immunologist, adds it aligns with how other emergency medications, like Naloxone for opioid overdoses, have already been made OTC in several states with positive outcomes. Implementation of this solution would look like the FDA reclassifying EpiPens as OTC medications after reviewing safety and usage guidelines. Pharmaceutical companies would update labeling for clear instructions, and pharmacies would stock EpiPens in accessible areas similar to first aid supplies. Public awareness campaigns could educate consumers about recognizing anaphylaxis and how to properly use an EpiPen. Now that we've figured out a solution, what does the future look like with that solution? Dr. Brown, an emergency medicine attending physician at the Seattle Children's Hospital, also sees a bright future if EpiPens become OTC. It lets more people be able to purchase and carry them. Parents, teachers, coaches, and individuals with allergies will now have the freedom to carry them easily. Lives will be saved because epinephrine will be readily available when seconds matter. Schools, restaurants, and community centers could easily keep EpiPens on hand for emergencies. If the status quo of prescription-only, expensive EpiPens continues, people will keep dying from allergic reactions that could have been saved with timely treatment. Prescription barriers and high costs will continue to exclude the most vulnerable, especially uninsured or low-income individuals. The preventable loss of life will persist. We began by identifying the dangers of limited access to EpiPens and the lives lost because of this barrier. By making EpiPens OTC, we directly address that need, ensuring that no one has to watch a loved one die simply because we couldn't get a prescription fast enough. With a bright future ahead, what can we do to make it happen? EpiPens save lives, but only if people can access them. EpiPens are hard to get, but the plan of making them OTC helps fix that, and the future looks like improving public safety and ensuring life-saving medication is always within reach. Contacting the FDA, your state health department, and your local congressional representative would be a good first step towards change. Ask them to support the reclassification of EpiPens as OTC medications. No one should lose their life because health was locked behind a prescription cap. Making EpiPens over the counter is not just smart policy, it's a moral necessity. Let's make this simple step to make every life safer.